The state coordinator on homelessness, plus Connie Mitchell from the Institute for Human Services. Spotlight Now starts now.
You're watching Spotlight Now with Ryan Kalei-Suchi and Yunji Denise on Hawaii News Now. Have questions or comments for our guests? Join the conversation in our Facebook live stream. Spotlight Now, where Hawaii comes to talk.
Well, aloha, and thanks for tuning in here on this Veterans Day. We also want to just, of course, give a shout out to our veterans out there and hope you are spending this day well. We want to thank all of you for tuning in. We're going to get to our first guest in just a few moments. We always want to encourage those of you who are watching either on air or online to participate in the conversation. And this is definitely a topic that impacts many in our community. And so we want to hear from you. You can email your questions to spotlightnow@hawaiinewsnow.com, or you can also find us on Facebook and enter your comments there as well.
And we want to welcome in our first guest, and that is Jun Yang. He's the governor's coordinator on homelessness. Thank you so much for being here.
Well, thank you for having me, Angie.
It's great to see you. You know, you're a familiar face to a lot of us. You've been working in this space for a long time, first with the city and then Department of Transportation, and now taking on this role as part of the governor's cabinet. Tell us a little bit about sort of how you see this issue. And, you know, I mean, it is such a complicated problem. You've been working in it over a decade. What do you see changing, and what are the biggest issues, you know, sort of out that impact this space?
Yeah, well, let me take a step back and say first, I want to say thank you to all our veterans. They've served, those who have served and those to protect our country, those who wear the uniform today. I have a lot of friends who have served and are serving today, and I want to say hats off. We are proud of you, and we thank you for your service. So when we started working on, when I started working on homelessness, the numbers were pretty high. So if we look back 10 years, we had almost 8,000 individuals experiencing homelessness at any given time. The point-in-time count, you know, as we know, is not a perfect science. It's just one way to trend and see how we're doing in our communities. And I was going to give an analogy. I'm not sure if it's really appropriate. We'll try. It's kind of like looking at the sky and seeing how many birds there are in the state on that day, and really saying, okay, that's the population. It's really hard to really track, but it gives us a trending of how we're doing in our policies, on our building. So 10 years ago, we had nearly 8,000 people in our shelters, unsheltered across the state. Today, we are doing better. In 2024, the number was at about just under 6,400 individuals. Still some way to go. We still have a lot of work to do, but at least we're trending in the right direction. We haven't had a point-in-time count this year, but in 2026, we'll have in January, and we hope that it continues to trend in that direction.
So without that data readily available at this point in time, how then are you using metrics, or what other methods are you using to really track where things stand right now, so you have a better idea of, you know, the demographic, the type of people, the individuals that we're seeing on the street, to help make some policy changes if needed?
So we do know a number of things. We know that we need deeply affordable housing. And that's part of the reason why the governor has moved forward on the Kauhale initiative. Governor Green really has a big vision, and is to house as many of our unsheltered, those experiencing unsheltered homelessness as fast as possible. Kauhale, the whole idea behind it is to build community and to be innovative in that approach. And so that's what we're trying to do. The past couple of years, this office has really kind of taken that lead to build these units out, tiny homes, villages across the state, and we have 24. One of the things that we do know is that working with our service providers, we ask them, how are we doing? And they will tell us, we're seeing these type of trends. And we're using the point-in-time count data as best as we can to show, 10 years ago, our family homelessness was nearly about, I would say, about 800 families across the state. Today, we've reduced it by more than 50%. For our veteran homelessness initiative that I worked on together at the city, we went from 700 veterans on the street to seeing less than, I think the number was 320. So we're seeing big number changes over 10 years. That means that we're in the right direction. Still a lot of work to do. We're almost there on these specific populations. But the area that we want to work on within this administration really is to make a change on our unsheltered population. That's a number that we have some concerns about.
Yeah, I mean, tell me a little bit about that, because I think there are the numbers and then there's just the perception and the way people feel,
Yeah,
right?
absolutely.
And I live downtown, and I know that after a certain time of the day, I don't want to go outside and walk around with my kids, you know? And I feel like even if the numbers look better, the way that people feel in community hasn't necessarily improved.
I understand. Well, I've throughout the years, I live just above town, and so I've walked through downtown and Chinatown with my daughter. When she was younger, it was kind of tough. But today, she's 15, and it's a little bit easier to walk around with her, and she's very much aware of what's going on. One thing that we see is that we want to actually encourage our community that our Kauhales and our homeless individuals, they need a lot of help, right? We do understand the concerns that people are seeing in the businesses and along the streets. And we have a lot of partners working together. We have our church, faith-based groups. I know this is a little bit controversial, but we do have law enforcement that want to help open up the spaces for all public use, right? So parks and sidewalks and the such. And so we see a lot of the initiatives that each of the counties are doing. But the part that we are asking for help with, to help kind of make that change across the community, across the state, is to adopt these ideas like Kauhale in your community. Because if we can't find places to build these out, we're not going to see a change in your areas. We're not going to see a change in downtown, in Chinatown. We're not going to see a change on Maui or on Big Island. We're not going to see this that we need. And so if you would adopt Kauhale into your community, it'll be a lot easier for us to make that change together.
Let's talk a little bit about this Kauhale, and we know that this is something that the governor has advocated for even before his time, before officially becoming governor, but has really taken this on as one of the ways in which the state is combating homelessness. Based on what we've seen over the years, what is working with the Kauhales, and maybe what isn't? What are some of the adjustments that are having to be made, knowing that this is not necessarily a permanent solution, but how is this permanent solution, I should say, for individuals trying to live there long term? So what are some of the lessons learned from the Kauhales, and what can we expect moving forward?
Thank you for the question. I think one of the things that we've learned from in the windward side, we have one of the first tiny village Kauhales that we built out in a big way for long term, right? If you go to our partners, to Project Vision, IHS, to Hawaii Health and Harm Reduction, and Homemade Hawaii, if you go to their websites, onto their Instagram page, you'll see some of these stories, and you'll see transformation. You'll see people coming into our Kauhales, and their lives are forever changed in a positive way. How does that happen? They come into a place where the community is building a community around this individual and helping that person heal. One thing that Governor says over and over again, and which I completely buy into, which is housing is healthcare, right? These individuals are coming in and they are being healed through the community that they're a part of there. I really do want to encourage you to look. It's really blown me away to hear stories about Marvin and Julia and just watching their life change. Over the course of that project we opened up in January of last year, and it's we see tremendous change. The challenges that we see, I know that in Iwalei we had a little bit of a challenge with our senior residences next door. What we're coming to find is that we want to be able to build infrastructure into our Kauhales as soon as possible, so that we can plug these in and make them as useful immediately. And we have to work a little bit better in communicating with our community. So we want to make sure that we have the partnerships in place with HECO and with all the utilities, making sure that we can build these in quickly so that we can deliver on the community to the individuals that we serve.
We noted at the top that you're not new to the space, but you're relatively new to the job. In February, so not that new, but But you are the third homeless director for the state in 3 years. Why do you think there has been that turnover in this role? I mean, it certainly is a very challenging job.
So I've had the privilege of working with every single homeless coordinator that's been in the state. And they've all had their personalities, and they've all had a beautiful heart to work on this challenging the issue for the state on behalf of the administration. And it is a challenging role, but it's not one that I don't think that I'm not afraid of challenges. I look at a problem and try to work the problem. Just start, what do they say? The adage is, how do you eat an elephant? One bite at a time, right? It really is just trying to find the problem and work it out, work it through. I have excellent staff. So I was able to inherit and also hire some excellent people who have a heart to serve this community. So they know who they're serving. Many of them have actually been service providers or worked in the service provider side. So they know who they're serving. That heart is important for me to be able to deliver the way that we need to deliver it. The second part is they all want to be able to deliver the projects quickly. And that's something that I want to do. This is a hard thing to do, but we want to be able to do that for this administration and for the state.
We know that this is also not just confined to what's happening here on Oahu, but that this is a statewide problem that spans all islands. I just want to get your comments on what's being done, maybe, or what you're seeing on the neighbor islands. I can say for myself, being someone who's born and raised in Hilo, back in the day, you knew the names of the homeless people. There weren't a lot, but you knew who they were, and because there were just so few of them. And now, just going back to visit, there is a lot more that we're seeing on the streets. So again, this is not something that's just confined to what we're seeing in these populations here on Oahu. What can you say about what's being done on some of the neighbor islands and some of the growth that maybe is happening in this community?
Sure. I want to say thank you to our legislature, because without their support, we wouldn't have the budget that we have that was passed this year. $88 million is the first time we've received any funding of that sort, that size, for my office. My office is a small team, and it really is just to deliver on these type of projects, to make innovative approaches across the state. So it's not only Oahu, we're looking at Kauai, Maui, and Hawaii Island. So we do have Kauhale programs and projects on each island, and we have great partnerships with the counties there, and also with service providers like Family Life Center and Hope Services. They are the ones that are delivering on what we're trying to do on each of our neighbor islands. So we have projects that work on mental health services and house individuals with severe mental illness in Kapuna. On neighbor islands, we have those who are serving our unsheltered and overnight shelters as well. So these are things that we're trying to build out even more. We have 8 projects across the neighbor islands, and we're trying to build out more over the next coming year or so.
When Governor Ige was tackling this issue, he really put families at the forefront, because we were seeing, especially in the Kaka'ako area, Kewalo Basin, we were seeing lots of families, and we were seeing kids on the street. We don't see that as much anymore because of the gains that you noted. But with this particular administration, how do you define success? What are the areas that you think that you're most focused on? What would be your metric?
So under the previous administration, Governor Ige did focus on families, and I do want to say a big thank you to the Hawaii Community Foundation. They had an initiative called Housing ASAP, working with service providers across the state. And so that's part of the reason why we see the reduction in the homeless family populations. For us, when we're looking, for me actually, when I look at success, we have a goal of delivering 30 Kauhale projects. That means 30 more opportunities for individuals to come off of the street. Unsheltered individuals who've been on the street for a long time, on the beaches. That's one way for us to say that we're going in the right direction. It's the beginning of change for a lot of people. And for me, if I can get that and deliver that for this state on behalf of the administration, I see that as success for our team.
This is a timely subject as we talk about homelessness, because as we know, with everything going on in our state, with cuts that are being made to those in our community who are struggling the most, there is fear that we could see more of this growth in the homeless population because of all the federal cuts that are happening. As you mentioned, the nonprofits are important partners. How do you navigate that piece right now with so many of these nonprofits fearful about funding, about how they will continue to be able to provide these services when there are, some dire times ahead for some of these nonprofits?
So we have been tracking what's going on in Washington, D.C. The Department of Housing and Urban Development, HUD, they are starting to make some changes in the way they do funding and deliver the funding to our state through our service provider network. That's a concern for us. Any changes means that there might be a delay in services. And so where it's a gap, for the state, I want to be able to be open to figure out together with the community, how do we fill in those gaps as times change, as programs change. And we know with this administration in DC, things are changing. And so with that, we'll have to work on that challenge together. Our service provider nonprofits are the hands and the feet that actually work on the work for us on behalf of the state, on behalf of the community. And so we want to be able to support them as the best way that we can.
You know, these problems feel so layered, right? Because you have you have drug addiction, you have mental health, you have, when you talk about someone who's been homeless for years and years, that person needs a lot of work to actually get them off the street. It's not as simple as just giving them some cash, right? So when you're approaching that, I mean, do we have the capacity to actually help all of these people?
So in the time that I've come and sat down with our service providers and watched and gone out to do some outreach with them, it takes a consistent presence with individuals and building a rapport. Do we have all the resources? Do we have all the staffing? Do we have everything that we need? I don't think there's anything out there, the big problems, that have all the things at their disposal to fix anything. Right? You're looking at big problems. They all have resource constraints. But in there, we have opportunities for innovation. Now, my father is a missionary retired minister, but he worked in tech for a long time. So he was, at Intel during Pentium. And I grew up in that time. And so around me was technology and innovation. And so that's always just got a little bit of a part of the DNA that it's just kind of going around in my head. People are around that want to find solutions to problems. And so I'm interested in working and partnering with people in new ways to deliver better on the services that are out there. When we have service providers that don't have enough, we have to find ways to fill that gap. I want to find good, innovative ways that will deliver on that promise. Yeah.
Well, one of the things that we've also been seeing and hearing about for some time now are those visitors who come here and end up, for whatever reason, being homeless on their visit here, or they purposely, some were sent here to the islands. The mayor has sat in this seat and said that he was going to send a letter to the mayor of Los Angeles saying not to send any homeless over ahead of the LA Olympics in a few years. What are we really seeing with this population of visitors who are now stranded here, become homeless, or come here as homeless individuals, and the state sending them back?
I know this is a serious conversation, but I have a funny story. My wife just told me yesterday that there's a tourist blogger on YouTube that came from Korea last week on a really cheap but business ticket, round-trip ticket. And he only had one day of stay at a hotel. And so the customs agent said, are you coming here to be homeless? Because he only had 2 shirts in his bag. So it's an issue that people, it's on the forefront of everybody's mind. The issue of homelessness is in every community. If there's anybody listening from the mainland, we want to say, check your resources, because our community here, we have the same amount of challenges that you do in Denver or anywhere that you might be coming from. But for those who are here that have made their way here, we do hear from our tourist industry, our hotels, that they're encountering individuals that are from elsewhere. And so they've created a pilot that we've now kind of built into a program out of my office and now moved over into the Department of Transportation called the Return to Home. And through a partnership, the contractor is IHS. The Institute for Human Services has been able to work on a way to bring people back from here for those who want to go back, who are willing and have a support system that's willing to receive them. It's a warm handoff. We don't want to move somebody from, as we always talk about it, from homelessness to homelessness is not what we want to do. We want to be able to bring in a warm handoff. So as we're bringing the person from here, there is a commitment to pay for half of the ticket, and that there is a support network on the other side. So that's a project that we have about 150 people that have moved back to the mainland, and we're targeting hopefully to get to about 200 individuals over the year.
You know, we saw a pretty big sweep on Friday in Nanakuli on the beaches. We know that on the west side there are quite a few people who are living along the shoreline. Sweeps are very controversial, and you know, there's something that a lot of folks in our community are not comfortable with, because you're essentially just moving homeless folks from one community to another. What is your take on sweeps and what to do? Because at the same time, people who live in those communities feel like, I don't want this encampment right next to my residence. So how do you balance that?
It is a tough issue when you have encampments, and encampments, they usually don't stay a certain size. They grow over time. But there's individuals that are in each of those encampments and people in real need. And so the first thing that when I look at it, I'm looking at it as making sure that we have services provided for the individuals. They're getting connected to services. They're getting connected to housing stably. The issue of the encampments really is, how do we bring the person from unsheltered situations into a stable housed position, right? That's what we're trying to do. That's the ultimate goal. And so helping the individuals do that with groups like KWO out on the west side, they are actively engaging with the families out there. So that Nanakuli cleanup operation, as hard as it was to see, had some really positive outcomes. And those positive outcomes are families and individuals moving into shelter and into housing. These are individuals that haven't been in shelter and housing for a long time. So it is controversial, it is difficult. It's difficult to see, but the other side of it is that you see a beginning of people's lives transformed and their trajectory changing.
Talk about the relationship that's existing right now between the state and the city. You know, we've had a number of leaders in this position at times. Again, they've come on this show, they've talked about how they're working together and pledging to move forward. And of course, there are, like anything else, there's transitions in positions, and we find now different leaders in these roles, both your position and at the city. If you can speak to that, the importance of that partnership with the city, because they do play a large hand in this, and how do you folks get on the same page in terms of the game plan moving forward, especially when it comes to what's happening here on Oahu?
Yes, so we do work really closely together. This is one time that when we've said this in the past, it sounds like a talking point, but the difference now is that we're actually in the room together, planning together. So the city and county of Honolulu may have a facility that we may be able to operate a project out of, a program out of. To give you an example, the old Tokai University has what we call the Waikiki Vista project. That is the ability to use 4 stories or 4 floors of their property to house one of our Kauhale programs. And so this is a beautiful opportunity to kind of blend resources together. That's a good example of how we work on this together. Our service provider at that project is Catholic Charities, amazing partner in what we do. And that project specifically houses our families. When we look at how can we serve, we don't want to just say, I'm going to be an island amongst an island, right? In the community, we want to make sure that we are servicing with the community partners, which includes each of our counties. And so counties on Kauai, on Maui, and Hawaii Island, each of the homeless coordinators there we are in communication and trying to find partnerships and ways to work together.
I think that you've been in this space for some time. Mayor Caldwell, his whole initiative was Housing First. We've heard a lot of different programs, and well-intended, but not necessarily creating the communities that we want to see. What do you wish people understood about this issue, how difficult it is, and what kind of grace they need to give your office?
Yeah. Well, they don't have to give grace to my office. I think where I would ask for grace is to the individuals that are on the street. My daughter's gonna, if she's watching, she's gonna say, "Dad, stop it." So when we look at the thing that we're looking at is our communities, I'm hoping that they will adopt these opportunities. have a chance to look at the Kauhales that are in your neighborhood, have a chance to walk in. If you're a part of a club or an organization, Lions Club or a faith group, take an opportunity to come in and visit and find ways to build a stronger community. That's one way that we can really change what the perspective is. The challenges to my office are just challenges to my office. That's fine. But to make changes, permanent changes in our community, everybody needs to come together on it for sure.
You know, we see the emotion here, and it's got to be a tough role to experience this every day and to see all the things that you're experiencing firsthand. What would you like the public to know about just maybe the misconceptions about homelessness? What do you enjoy about being in this role and serving in this capacity and trying to do this for the community?
So I know that people, you've grown up at school. You have children in school, you have aunts, you have nieces, you have nephews. And at the school, you may not think this, but there are people who are suffering right now. They are living in cars, couch surfing, they might be on the beach. You may not think about that, but there are people in your community that go to your church, that are part of your volleyball team or basketball team, wherever it might be. You have people that are really struggling right now. So when we talk about homelessness, this is not their issue or it's an other issue. It's our issue. So I want to encourage everybody to just get a chance to know a little bit more about this. Go in to find ways to support. This is a great time to do so. It's Thanksgiving, it's Christmas time coming up, it's the New Year. It's a great time to be a part of the community in this way. Get to know. You have service providers and organizations all around the island that do great work, that serve the community. Go out and if you just want to come out and volunteer, please do. If it's just to get to know, you'll know more about your community. Other than that, I want to say that our Kauhales, what we're trying to do in each of our communities is build out resiliency and stability. And when we have community coming in, all the different organizations, that builds a stronger community. This person has stronger legs to stand on once they leave the project itself.
Okay, Jun Yang, thank you so much for being here today. We learned so much, and we hope to have you again soon.
Thank you very much for the time.
Connie Mitchell joins us on the other side of the break. You're watching Spotlight Now.
From the moment you wake up.
Hawaii News Now brings you the stories that impact your day.
With more on the breaking news, we go live to Casey Lund.
Ready with the push alert? I'm going live. We have an update to the breaking news we brought you this morning on Sunrise.
Okay, guys, as soon as this wraps, toss to Mahia.
And we've been covering this story all day.
Now we go live to Mahia for a new development.
Stand by for breaking news. They just captured the suspect.
That's confirmed?
Yes, sources just confirmed it.
The news you need the moment it breaks.
Here on Hawaii News Now.
First alert traffic is like always having a helpful passenger right next to you.
There's a crash up ahead in the left lane.
When we see a backup, we'll tell you live on TV.
That doesn't look too good.
And send an alert to your phone.
I'll type, you drive.
First alert traffic on TV, streaming, and on the Hawaii News Now app.
Keeping you and your ohana safe.
Spotlight Now with Yunji Denise and Ryan Kalei Suchi. Connecting you with newsmakers from throughout our islands. Going in depth with Hawaii's leaders. And taking your questions live. Spotlight Now, where Hawaii comes to talk.
Well, welcome back to Spotlight Now. We're continuing on in our conversation today, directly talking about homelessness and the impacts that it's having in our community and some of the success, as well as the challenges that continue to lie ahead. We want to, of course, encourage all of you who are actively involved, sending us messages. Continue to send in your questions and comments, and you can also email us here at spotlightnow@hawaiinewsnow.com.
And we want to welcome in our next guest, and that is Connie Mitchell from the Institute of Human Services. You know, Connie, Jun Yang spoke highly of your organization, doing some of the work to bring the mainland folks back to their own communities, and we'll talk about that in a second. But big picture, you know, you've worked with a number of people in the role that he's serving in now over the years. What are your thoughts about the way the state, you know, the way the governor's office in particular is tackling this issue?
I think the fact that we have so much more collaboration is huge. I think the way that the city and the state are really coming together and sharing resources, assigning certain responsibilities so that it's clear, you're not going to double up on some of the things that need to be done. And it gives us a greater ability to use the resources in the most efficient way. So it was really neat to hear Jun talk about that a little bit more. I think the two things that I also heard in what he was talking about is the theme of collaboration, not just between the two of them necessarily, but I think for us, we've always been wanting to collaborate more, and I feel like we've been given more opportunity to do that. And the other one was innovation, and it's just really trying different things, and not just sticking with the same old, but really doing shelter differently, doing outreach differently, so to me it's been really exciting.
One of the unique things that you provide is a perspective of what's actually happening on the ground. Oftentimes, when we talk to some of the leaders who are trying to do this work, they are, of course, managing programs and trying to facilitate funding and resources. You are someone that works directly, hands-on with this community. What can you tell us about where just things stand right now, what you're noticing, what you're seeing, if there has been an improvement, and if anything that's happened within the last few weeks has impacted your organization?
I think there certainly has been, some changes in, I'll start with the last question you had about, the impacts of some of the things that have been happening in D.C. I think the amount of change that people are having to, deal with, not just the folks who get the final impact, but the people who are trying to help them. From one day to the next, we don't know, what's really going to happen. Like with the SNAP benefits, for instance, that was a huge one. First they were saying, okay, no more. And then, you have to get ready and have everybody ready to reapply. And then with the government shutdown, there was nothing. And then, the governor came out with, really helping out folks to at least get half of their benefits. And then we thought we were going to get the benefits after all, and then there was a appeal, so we're not even sure what's happening half the time. But it does impact us, and it impacts other nonprofits like the Hawaii Food Bank. I mean, they have done such a tremendous job, pulling a lot of resources together and appealing to the legislature, and then also the food pantry, and they are wonderful here also, and on the neighbor islands as well. So everybody's pitching in, and that's what I see as something that the moment in time that we're in right now gives us the opportunity to do once again. Because it's kind of, I'm thinking about the Maui wildfires and how that happened, and it brought a lot of people together. And I'm really hoping and praying that that does the same thing, with all the things that we're having to do, that more people will feel like, I really want to be a part of the solution, and that they will step up, to help also.
Yeah, I mean, you heard Jun there talking about really community embracing the concept of Kauhale, trying to do more volunteering, trying to help on the ground. He talked about how, 10 years ago we were at 8,000. Now he said somewhere around 6 by his estimate. We're waiting for that point in time count next year. Who are you seeing come through your doors? I'm wondering, because when we've talked in the past, you've talked about seniors in particular. What kind of trends are you seeing on the ground?
That's one of them, Yunji. I think that there are people who have maybe been homeless for a while, and they're aging on the street. And so we see those people with more disabilities, more chronic conditions that they're dealing with. And that's why we started to do more medical respite, having people be able to come in for medical support. If they're coming out of the hospital with no place to go, at least they have a place to land so that they can recover and then maybe move back into the shelter. So that's a big one. And the Department of Human Services is going to be, through Medicaid, actually paying for that, come January, as long as people are credentialed. So I'm hopeful that, some of these things that we've tried to help with are actually being picked up by the government as well. So seniors who have been on the street for a long time, then you got the other folks that have never experienced homeless before, and they're actually experiencing hikes in their rents, or not able to afford their mortgages anymore because their HOA fees went through the roof. And I'm thinking, okay, that's a new one on me, that if people actually own their home and they can no longer afford it because of a combination of, maybe somebody losing their job, later in life and not being able to recover because it was a medical condition. I had one person that came in who had a stroke, or a couple of strokes, and that was really hard, for that couple to, really recover from. So I think there's definitely, two distinct groups, that are older and, they're needing help, and we have to come up with two different kinds of solutions in some ways. So it's really, like listening to people, understanding what they've been through, and fashioning a new solution for people, if we've never experienced it before. Another group is the folks who are dealing with substance use disorders. And I think I mentioned in another time that I spoke with you about how the drugs have changed and they are being more powerful and just harder to get off of. And so that's why we started to, put out there the Imialapiha Homeless Triage Center, where we can help with medically assisted detox. So it's, helping them get through this really hard time that, the drugs are so strong, it's hard to actually get off of them without just giving into the fact that I can't do this. It's just too painful because of maybe the seizures, convulsions, whatever they're experiencing. So we got to come up with some new solutions, to some of the things that we're seeing.
As you describe all of that, it just sounds like there's just so much that continues to come at you, and different scenarios and things that you're having to process through. And with that, of course, requires resourcing and funding. And I'm wondering where you folks stand right now. Are you at all worried about just the cuts that are coming beyond, what's happening with SNAP benefits and the, the government being shut down right now? But overall, we hear from nonprofits about the importance of the safety nets, the importance of finding new ways to gather revenue to be able to support not only their existing services, but as you mentioned, all these new things that they now find themselves tasked with. How concerned are you about just where you folks stand and all the services you need to provide and the funding that requires it to do that?
I'm super concerned. Even though at first I thought, well, maybe it doesn't affect us that much, because we don't have that many federal grants. But we are still concerned because we have the Imialapiha Homeless Triage Center that still hasn't really been funded. There's not a designated funding for that. And we have to, really kind of piece together a lot of times the funding for different programs. So we've really tried to diversify our funding streams. But even with that, there's so much more administration because we're having to, if we have more different funding streams, we have to meet the requirements of more different funders, so it's really a challenge. And I think even if it's not impacting me directly in my budget now, I know that if, say, Parents and Children Together doesn't get their funding, then I'm not going to have children who have a program to go to. They're not having, the preschool, services that they need. So it's really, we're all in this together, and what impacts another nonprofit is certainly going to impact us in the long run, is what I think.
We've talked about this before, the issue of folks coming from the continent or other places and coming here. Are you seeing that? And what is the latest on that?
Yeah, that definitely is a problem. I think back in April of this year, we made a concerted effort to determine, how many in fact are coming. And we looked at our men's shelter, which is our largest shelter and the most turnover. And in April, 39% of our intakes, our new intakes, were not from Hawaii, which tells me that there's this constant flow of people coming in. So as Jun was saying, there's a lot of people that we've managed to help get out of homelessness. If we keep having new people come here or new people fall into homelessness, because it isn't just the folks that are coming from the continent, we do have people here also entering homelessness too, but the combination of the two is sometimes just really overwhelming. But I think, we've been trying to really be very again, trying to apply some innovation to this, but also working with the state with the relocation program. We've decided that we want to maybe go to the airport and be a little bit more, proactive about connecting with people that may look like they might be coming here and needing help. At least to let them know if you get into trouble, like they use up their money in Waikiki and they need help, we're here and we can help you. And really kind of have those conversations with people to ask them, why are you here? And many times they're either running from something or they feel like it's going to be paradise here. You're going to really have a better life here, right? And sometimes I think on the continent, the intensity of the conflicts and the division is a lot more than in Hawaii. I mean, we have our own share of that, but I think it's a lot more intense, on the continent. And so I believe that there are many people who are fleeing that and feeling that maybe it's a little bit safer here. Even if, you're on the continent and you're a legal immigrant, they're running into problems, right? So they're feeling like, well, maybe they can come here and have a, more of a sanctuary here in Hawaii. So people come for different reasons, and certainly, like sometimes, people just want to come because they are thinking they had like a family member here. We have that a lot, and they feel like, okay, I'm going to go stay with my auntie, and they stay for a little while, but then they have some disagreements, and then they're out, and then they're homeless. So many different reasons, and I think we really have to come up with some different solutions all the time.
Are you really seeing any states or cities that are actually pushing people to come to Hawaii? Because the scenarios you mentioned are more people kind of deciding on their own will, but we've heard other scenarios where it's actually government officials or entities there that are encouraging them or sometimes financing this transition. Have you ever heard anything like that?
Once in a while we do, but then we report it to the state, and they usually take care of it because they'll confront that other government to just tell them that that's not okay. So I think I think everybody agrees they don't want more, and we don't want more. And our geographic location in the middle of the Pacific makes it very difficult for people to be returned. I mean, a lot harder than putting somebody on a bus, and sending them home that way. But we are making gains, like Jun was saying. I think we're up to 160 right now, of people that have left that we've helped back home this year. And I'm hoping to, get pretty close to 200.
Yeah. What would you say to folks about this issue when we're looking at it sort of broadly? Because the same thing we kind of asked Jun, that there are the numbers, but then there's the perception. And if you walk through certain neighborhoods, and now it's really, I would say statewide, right? That we are feeling the impact of homelessness.
Yes.
What do you wish people understood about this issue?
I think it's exactly what Jun said. Like if it's always not in my backyard and not in my community, and you're trying to push them out, they're going to be in somebody else's community. And so, he was saying if there's a program that comes into your community, embrace it, support it, and we'll be able to find ways, to help those people come off the street instead of just pushing them to another community, right? So I think for us, we really want others to host, some of these programs. I feel like Ivale is a little bit too dense, with homeless individuals. We'd really like to be able to help more folks actually get to know some of these people, because some of the folks that go into the other communities, many of them, they're trying to maybe hide or not be so obvious and not be bothered, by other people or the police, right? So I think in general, we really need everybody to step up, I think.
Is there any other way that the community can support, during this time, specifically, in any other area? I think this is a time where we're seeing community come together in many different ways. But specifically for this issue and what you folks do, I mean, where are some of the biggest needs that you see within your organization?
There's so many, so many ways that people can help us. People can do drives for us, food drives for one. Like even if you wanted to do a chicken drive or, a rice drive or something like that would be really helpful. But we also ask people if you have fruit trees, and you have extra fruit, that is coming ulu or mango or whatever. We could use fresh vegetables and fruits. But we also have people moving into housing. We're helping a lot of people get into housing. And when they do, they need things to start up again. All of us have moved at one point or another, and you need kitchen supplies, you need cleaning supplies, things like that cost a lot. So anything that people can help is really very, very appreciated. Now, you were mentioning this time of the season, and we do have a lot of people coming out. We still need a few more Christmas trees. We need some decorations maybe, or people just come and be with people, play games with them, and just really help them to be uplifted. When people have experienced homelessness, that this time during the holidays is some of the hardest times. And so we really want to encourage people and, help them connect with other people, because that's so powerful, when other people are there and you can actually feel like somebody cares about you, So I think people coming down, helping us decorate, helping us, be able to, make sure that all the kids have something, that they want, and even the adults, to just really help them out. I know our men's shelter is the one that often gets neglected, but, really, if people could help, it would just brighten their lives, so much to know that somebody cares.
Well, Connie Mitchell, thank you so much for the work that you do, and thank you for being here with us today. We really appreciate it.
Mahalo so much.
We are going to be talking about an innovative program run by Hawaii Pacific Health, helping the job pipeline in healthcare after the break. Stay with us.
Well, aloha and welcome back here to Spotlight Now as we continue on in our Community Spotlight segment. This is a segment sponsored by Hawaii Pacific Health, and we're going to get to know a little bit more about some of the things they're doing in our community.
Yeah, we love this segment, and we love our two guests today because they're doing such important work in the area of creating job pipelines for local folks to stay in community and create the healthcare workers that we all need. Dr. Leslie Chun is the CEO of Hawaii Pacific Health Medical Group, and Mae Dorado is the Community Allied Health Education Program Manager for Hawaii Pacific Health. Thank you both for being here.
Thanks for having us.
So just for a little bit of background, Mae, if we could start with you, tell us about the education programs that you've created and who we're seeing go through them.
So we do a medical assistant training program, and medical assistants, what they do is they work with a provider like Dr. Chun in the doctor's offices or even in the clinics. They're the ones that do the communication with the patients, work them up, get their vitals, assist with the doctor's visit, and then discharge the patient. So they do a lot of the workflow and making sure the doctor's schedule is flowing smoothly.
And the program that you're running, it's actually in the high schools.
That's correct. So we have a training program that's available for high school seniors. If you're in any of the public schools here on Oahu, then you're eligible to do this in your senior year of high school. So I work with them the whole year, and when they're ready to graduate, they go through some time where they do 225 hours of clinicals. They're actually working in a facility, which is the Hawaii Pacific Health Clinic. And one of those is the Waipahu Health Center that we have on the campus.
Yeah, and Dr. Chun, tell us a little bit about that.
Yunji and Ryan, thank you for having us on the air for this. The clinic at Waipahu High School, it's an academic health center, and it's a fully functional clinic located right there on the campus of Waipahu High School. It's a beautiful clinic. We have family medicine there. We have OBGYN. But what makes it truly unique and one of a kind in the U.S. is that it allows high school students to rotate through there and learn with hands-on experience in a live clinic. It's truly exceptional, and it's been a partnership between HPH, Hawaii Pacific Health, the Department of Education, as well as with the John A. Burns School of Medicine. And if I could do a shout out to Keith Hayashi, the superintendent of the DOE, as well as Principal Zachary Sheets. Their partnership and collaboration to making this possible is just enormous.
Yeah, and Waipahu High School is really famous for this academy kind of model. I mean, really an interesting way of doing education.
Yeah, and what can you tell us about what you're seeing thus far, the reaction from the students? I mean, and that's one of the things that you get to experience firsthand, is seeing some of the excitement and some of the things that the students are responding to. What directly are you seeing, Dr. Chun?
Gosh, it's been a tremendous experience for the students as well as the community. The students get hands-on experience with doctors, nurses, medical assistants, PSRs. And so it's been so popular that students are asking to have a repeat experience with the clinic, and hundreds have already gone through. In addition to that, the community loves it because there's a beautiful clinic right there in their community, not far from home. Many of them grew up in the town, and they're right there. And by getting their medical care, they're also contributing to the pipeline of future healthcare professionals.
Yeah, I mean, Mae, that's such an important point. Tell us a little bit about, we know what the jobs that you're training for. These are good jobs that we hear a lot about the brain drain in Hawaii, people leaving Hawaii for better jobs on the continent. Tell us about, the kind of the careers that these can lead to.
This will certainly get you your foot in the door. And there's a lot of people who actually don't have the opportunity to go to college. And so by doing this training in their high school year, once they step foot into, out of our program, they're earning as much as like $30 an hour. And that's pretty amazing for a lot of people who live here in Hawaii. And it's a very robust program. This is our 8th year right now that we're doing. And basically, it's like they're doing college level work. They're doing this training, they're having the opportunity to work in actual clinics, they're learning to work with providers and patients. We meet with them 3 days a week at a high school program, which is either at Waipahu High School or Farrington. And then on the weekends, on Saturdays, we work at one of the scrub clinics to do the hands-on skills, learn how to work with patients. And so it's really great. They're feeling more confident about being able to get out there and work in the healthcare field.
Yeah, and same question that I posed to Dr. Chun, but what are you hearing from them? I mean, because as someone who gets to see and work with the students directly, was there anything that surprised you that maybe you didn't expect when you started this journey, and just what you're learning yourself by engaging with the students in this way?
They're definitely developing the confidence that they need to be able to work in these areas, because a lot of them go out thinking, oh, I'm just going to get a minimum wage job in a restaurant or even in a store, but then they see that I can actually do this in the healthcare field, and then they're wanting to go on for more schooling because they're really feeling good about that. So I see them going into nursing school, medical school, and I've been doing this for 23 years now, and it's amazing to go out and run into my graduates and they're like, look, Miss Mae, I'm a nurse or I'm a doctor. So that really makes me feel good about it being full circle.
Yeah, Dr. Chun, talk a little bit about that pipeline that we are creating, because we do hear about the need for more medical professionals in our community, and it's very difficult to get folks from the continent to move here, and we want to have people who are from here delivering this care.
You're exactly right, Yunji. We need more and more physicians, nurses, medical assistants, PSRs, anyone in the healthcare field, but we have a pipeline issue, and we at Hawaii Pacific Health, along with great partners, are investing in the community to grow that. As a fifth generation family in Hawaii, I know, just like you, that people who grow up here and have strong roots, if they're trained in the right jobs, they can deliver amazing care because they're in tune with our community and know what everybody wants. And that's what we're all about in terms of these investments at Waipahu High School, at Farrington. We really want that next generation to grow and to realize that these jobs are all attainable. They're not out of reach, whether it's a doctor to a medical assistant to a nurse.
And just overall, do you think that the students, because I think about it, it can seem somewhat intimidating. The medical field can seem intimidating overall, but when you look at it, there are a number of opportunities within that field. It doesn't necessarily have to be a doctor per se. How do you help navigate that overall and just trying to expand and expose these students to all the opportunities out there, that it doesn't necessarily have to be what we think of when we think of the medical field?
And Ryan, you're right on. I mean, this exposure is in high school. They're really young. They have many more years and to decide. But having it at a young age to say, wow, I could be a doctor, I could be a nurse, I could be a patient service representative. Any one of those things are possible and within reach. I know growing up, many people don't meet that doctor or that nurse, and they think it's just someone else. But these people can do it themselves. And so that is that idea that they can believe that they're just like everybody else and have equal opportunity for that.
Yeah, Mae, you talked about seeing students in community. Just in a little bit of time we have left, what is your hope for the students who go through this program 5-10 years from now, and the outcomes that you're hoping for?
Of course, to just stay in the medical field. That's definitely a good thing. And then to bring back to the next generation, teach them how to teach being in the medical field and how good it is to be there, how rewarding it is.
And for you, Dr. Chun, I know that this is somewhat still, being rolled out and you're working through it, but what could you see this becoming long term? I mean, just the impact that it could have on the healthcare industry, and then just moving forward with future successes with, other students down the line.
I think Waipahu High School and the Academic Health Center can be a model for not just other schools in Hawaii, but throughout the nation. I know when President Biden, Jill Biden was here, she saw the clinic and just thought it was magical and thought other schools should follow. And Hawaii, we're a small state, but we can be leaders in the nation in great ideas and great execution. And I think this really helps help address some of the shortages we have in healthcare professionals.
It's such an exciting program. What a wonderful idea. Thank you both for being here today. We really appreciate it.
Thank you.
Thank you.
And we'll be right back after this.
From the moment you wake up.
Hawaii News Now brings you the stories that impact your day.
With more on the breaking news, we go live to Casey Lund.
Ready with the push alert? I'm going live.
We have an update to the breaking news we brought you this morning on Sunrise.
Okay, guys, as soon as this wraps, toss to Mahea.
And we've been covering this story all day.
Now we go live to Mahea for a new development.
Stand by for breaking news. They just captured the suspect.
That's confirmed?
Yes, sources just confirmed it.
The news you need the moment it breaks.
Here on Hawaii News Now.
Spotlight Now with Yunji Denise and Ryan Kalei Suchi. Connecting you with newsmakers from throughout our islands. Going in depth with Hawaii's leaders. And taking your questions live. Spotlight Now, where Hawaii comes to talk.
We want to thank our friends from Hawaii Pacific Health for coming by. Great to hear and see all the great things that they're doing in the community, especially to help raise up this next generation of healthcare professionals and the importance that it plays in our community. But we began our conversation earlier today talking about homelessness, talking with the state's not necessarily new. He's been on the job now for a few months, the homeless coordinator, Jun Yang, talking about some of the challenges that exist. But you really heard from him the continuation of that same theme that we've heard from the governor, and that is really this effort to really promote and improve Kauhale's. We've heard it a number of times in his interview.
Yeah, and so much compassion from him. You saw him get teared up at one point talking about how important it is to embrace these solutions and to not try to just move people along to other parts of our community. You also heard the same message from Connie Mitchell over at IHS, talking about also the impacts of the federal cuts, the pressure that her organization is feeling and all the partner organizations, and really calling on folks to come out during the holiday season and help.
Yeah, there is a definite need, and so we heard from both of them calling out to the community if there is a way that you can help, especially with the homeless population, and especially during this holiday season that's upon us. We really encourage you to get out there and support the community. Coming up next week, we catch up once again with Governor Josh Green, who will ask about the homeless efforts as well as a number of other things that the state continues to deal with.
Yeah, the state rolled out a lot of money to shore up those SNAP benefits. What happens to that program now? And hopefully by then the government will be back open, but there will be some hiccups, of course, to that. So we'll be asking him all about it. We'll see you then.
Aloha.